Symposium on STI in the era of antimicrobial resistance, current reality, high of care innovation, and future direction. So before we start our symposium at 8:30, so please complete your registration and pick up your material. And my name is Dr. Hadishon Pinchai, and I am honored to serve as your MC for today's symposium. So today we will explore one of the most pressing challenges in sexual health, antimicrobial resistance in sexually transmitted infection. So this symposium is organized by the Translational Epidemiology Graduate Program Initiative Project. So we hear more about this exciting news program later this morning. So we are privileged to have international and local experts who will share cutting-edge research, innovative diagnostic approaches, and new treatment strategies. Now let me invite our Dean of Faculty of Public Health to welcome us officially. So please, Dean Slavut Kripanon.
But first of all, I would like to say thank you very much for organizing this. And as you may know that the antimicrobial resistance, the AMR, will be integrated with this kind of sexual transmitted disease. I think it's very, very important. I would say that when I'm a boy, not a teenager, when I'm a boy, when we're talking about this kind of sexually transmitted disease, we just simply control it using the condom, right? That was like 30 years or 40 years ago, right? And it's a big challenge, particularly in the developing country, because we have those kind of HIV that spread all over the world during that time. But I think the behavior of people are changed because in the developing country, mostly of them, they use, I would say that they use the condom just only to prevent the opportunity of the pregnancy, right? Not mainly with HIV. Okay? But right now the technology is spread, it's changed, they have other way to control that. So that's why this traditional way is not enough. So that's why we have to concern on the new methodology and the new understanding how to prevent it. And not just only those have sexual transmitted disease, but I think right now we have also other emerging issue comes together with this. So it's a big challenge for us, people working in this kind of disease control and also the public health, to come up with this intervention. So thank you very much for organizing this, and I would like to say that I hope that this project will be very, very successful. And as the MC just mentioned that here in the Faculty of Public Health, we are now trying to have a new program on the translational epidemiology. And this issue is very, very interesting because of what? As typical people, we can make an intervention, but how to translate this properly to the public? I think this is very, very challenge for us. So this will be the good start for this program. So thank you very much for coming and join this program. Thank you.
For the opening remark from Mahidol University, I pleased to introduce Dr. Thira Ramasud. So Dr. Thira Ramasud he's a director of Rajapachal Samasai Foundation and former Director General for the Department of Disease Control of Thailand and Deputy Permanent Secretary of Ministry of Public Health Thailand. So please welcome Dr. Ramasud.
Dean of Faculty of Public Health, Mahidol University, Program Director of SCD, Dr. Sun, Dr. Martin Hamil, and his team from Johns Hopkins University, and our friend from Chulalongkorn and University as well. Distinguished guests, colleagues, and participants. This is a great honor to preside over the opening of the International Symposium on Sexual Transmitted Infection in the era of antimicrobial resistance. The resurgence of an ancient challenge. Today, we find ourselves at a critical turning point. STD diseases as old as humanity are staging a significant comeback, as you know well. Despite our past successes, as we did already mention, such as the landmark of 100% condom use program, which is a great success in that former time, that effectively killed the HIV/AIDS epidemic. So we are seeing a decline in vigilance, rapid social change, and a diminishing emphasis on safe-sex practice. These have led to a resurgence of infections that we once thought were under control. Reaching experience with innovation. This symposium is not just a gathering, it is a call to action. We must reach over this historical experience with a bold, forward-looking vision to address this current crisis. We need to move beyond traditional method and integrate cutting-edge innovation into our public health practice. Apart from well-established program today, in my opinion, as the former Director General of Department of Disease Control many years ago, I would like to add some comment that our discussion today may focus also applying many new technology and policy. First, genomics and molecular biology to enhance diagnostic precision and understand pathogen evolution together with prevention and control of drug resistance as well. Second, digital technology, to improve surveillance, outreach, and patient care in an increasingly connected world. Third, I want to add that strategic policy reform to adapt our national and international frameworks to the realities of modern society. In conclusion, I would like to urge all of you, in addition to the discussion today, to use this platform I mentioned to redefine our policies and strategies. Let us leverage this new technology to create more effective, inclusive, and sustainable intervention. I would like to thank the Department of Epidemiology, Faculty of Public Health, Mahidol University, and Chulalongkorn University as well, particularly those from Johns Hopkins University. I wish you all again here today that will lead to a new era of STD prevention and control. I now officially declare the International Symposium on Sexual Transmitted Infection open. Thank you very much.
So next, we are honored to have a strong collaboration with the Johns Hopkins University for this symposium to share opening remarks from Johns Hopkins University. Um, I will welcome Professor Amita Gupta. Professor Amita Gupta is a professor of infectious disease and director of the Division of Infectious Diseases at the Johns Hopkins School of Medicine. And she holds a joint appointment in the Department of International Health and the Johns Hopkins Bloomberg School of Public Health. So please join me in welcoming Professor Gupta.
You started very early this morning, and good evening to those of you who are joining from U.S. and other parts. It is a great honor to be part of the symposium, and I first of all would love to thank the organizers for putting together this STIs in the era of antimicrobial resistance, the current realities, point of care innovations, and future directions, which has been organized by the Mahidol University and the Department of Public Health, and specifically, as we heard from the Translational Epidemiology Graduate Program Initiative. I want to extend a special thanks to Professor Dr. Sarawat and Dean of the School of Public Health, and Dr. Ramasura from the Department of Public Health, and all the organizers, Rasaforn, Kita Womarn, San Solomani, and Matthew Hamill, who came together to put together this wonderful symposium. Also, I'd like to thank all of you, distinguished leaders, faculty, researchers, students, and partners who've come together today. It's very fitting that the two institutions that are come together to help pull this symposium actually have very long and storied histories and are collaborating now on a challenge that transcends borders and generations. As I understand it, Mahidol University traces its origins to the School of Medicine in Siraj Hospital, which was established in 1888. And similarly, Johns Hopkins University was founded in 1876, and then the medical school in 1893. So you're actually a little bit older than when we established our medical school. And then our public health school in 1916. And this was at a time when modern medicine was just beginning to take shape, and new approaches to public health and medical education were beginning to transform societies. And over the decades, both universities have grown into global leaders. Mahidol is really one of Thailand's premier public health and medical institutions, and I've actually had the chance to work with some of your colleagues in the Department of Pediatrics on a clinical trial related to tuberculosis. So it's really wonderful now to have the opportunity to interact with you in the public health field. And then Johns Hopkins has been also a global leader in research, clinical care, and public health. And so the two coming together really have a shared legacy of rigorous science, education, and service, and that really provides a strong foundation for our discussions and what I hope will be a meaningful partnership. I'm very delighted that 3 of our wonderful Johns Hopkins infectious diseases faculty will be joining you, Matthew Hamill, who's in the room, and you'll get to meet Khalil Ghanem and Johan Melendez. All 3 of them represent our finest faculty in sexually transmitted infection research, clinical care, and education, and I know you will enjoy hearing from them. As you heard already from both of our leaders who just spoke, antimicrobial resistance and sexually transmitted infections are intertwined public health problems that affect individuals, families, health systems, and economies. And importantly, antimicrobial resistance threatens the effectiveness of the medicines we rely on to treat bacterial, fungal, and other infections. At the same time, sexually transmitted infections continue to cause substantial morbidity and long-term consequences. And if they're left untreated, they can lead to infertility, cancer, adverse pregnancy outcomes, and increase the risk of HIV transmission. The rise of resistant organisms really complicates the diagnosis and treatment, and this is really an urgent area that needs coordinated action. You all will hear about the resistant gonorrhea and what new agents we have and how so rapidly resistance has emerged. You'll hear about other infections of Mycoplasma genitalium and some of the other infections that really are difficult to diagnose and to treat. These challenges are global, but they're also local. And I have no doubt with the deep expertise that both institutions bring to the table with their complementary strengths, we'll be able to really have some impact, some very lively discussions today. And hopefully we'll be able to begin to address some of the critical gaps, including enhancing surveillance and laboratory capacity for AMR and STI pathogens, developing and testing new rapid diagnostics, improving diagnostic stewardship and antimicrobial use across healthcare and community settings, advancing vaccine and treatment strategies, and of course, strengthening public health messaging and health systems for early detection and effective management. The only way forward is to work together for science-driven collaboration, partnership and capacity building, multi-sectorial engagement, and of course, always grounding it in principles of equity and accessibility. So I really look forward to hearing more from the symposia and hope that you will have a wonderful time interacting today and sort of really taking on the cause to address sexually transmitted infections locally, regionally, and globally. Thank you so much for giving me the opportunity to open this symposium, and I'm very grateful for the opportunity and hope that I get to come one day in person to meet all of you. Thank you.